social work program. It's called University Partnership Program, and you will take Child Welfare 1 and Child Welfare 2 anytime throughout. It's an elective offered. And if you wanted to do your internship in child welfare, that's what I'm hearing you say. We signed up with the state of Ohio. It was a grant we received last year to get the teacher and specialist who teaches child welfare. And you get a $5,000 sign-on bonus to work for a child welfare agency if you dedicate 12 months to them. So right when you graduate from May to May, if you work 12 months, you get that 5,000 as a seed money to buy like clothes and a car. So that was one grant that we had done. So a few things on a third research project we were doing called Racial Equity in Behavioral Health. We noticed that national research shows marginalized people face barriers, including access to culturally competent care and provider racial bias. Also stigma when seeking help for mental illness or substance use disorders. Racially and ethnically concordant services are associated with positive outcomes. So that's where our excitement to train more folks to go back to your city. What cities everyone from in here again? Just holler it out. Detroit, Chicago, Ann Arbor, Cleveland. So we got all the locals here. New Mexico, but I don't know which city. Okay. And then last city. But I know that there's lots of distractions during class, and there's always a cell phone. What city are you from? Columbus. Okay. So for the whole population of Ohio from 2010 to 2020, there's a 14% increase in age-adjusted death rate for suicide. Why it's important for us to train Black social workers. There's non-Hispanic and Black Ohioans. There was 87% increase during that same interval. So there was that includes coronavirus. So 2020, huge jump in suicide. You guys may even know somebody who their family suffered from a suicide in the family, and that's sad. So Black and non-Hispanic males now might have the highest drug overdose death rate in Ohio compared to other sex, race, and ethnicity groups. So we were looking at some of this as we're serving the population at Central State. Stress and anxiety are the most prevalent issues currently reported among college students. Meanwhile, 16% of the Black population experience a mental health episode. And there's your citation on this. It's about racial and ethnic disparities in mental health and the mental health care during the COVID-19 pandemic. So we saw a lot during COVID, and that's why we wanted to introduce this. I hope it shows up okay. So because of the effects of the coronavirus pandemic and challenges many students and families faced both psychologically and financially, Central State University offered the first trauma-informed care training in fall of 2021. So just a couple years ago, we're training everyone here to be trauma-informed, like knowing the global trauma was the pandemic like where were you all when it happened? Like life shut down, right? You had to go home. Or like put on a mask. Buy all the food that you can. The lines are out the door. Do you remember like that weird vibe? Food was off the shelf. Like, wasn't there shortages of things? Toilet paper. Yes. Okay. So that was a trauma for all of us. I might have used a Kleenex or a paper towel to wipe my rear end, but I survived, but it was just traumatic. Like it was weird. I bought chickens, I bought bees, I grew a huge garden. Like I got ready for it. Like, this is it. I'm living off the grid. Luckily that didn't happen, but we did the garden stuff. We prepared. So most students returned to in-person classes while still having the choice to attend online. There's a large push to have both in-person classes and faculty trained in trauma-informed guidelines. And there's your citation there. It's 10 years old, but it's still correct. And we were trying to mimic what's in Cincinnati. Nobody mentioned Cincinnati here yet, though, right? So you don't know Lighthouse Community School. And there it says the students need challenging work to facilitate their learning and must see their education as a way to foster civility, good citizenship, responsible behavior, and self-reliance. So that's part of the growing your own food. Trauma-informed care model attempts to meet each student at wherever he or she is in life. So I cited myself there. I don't know if that's like just like selfish or, there I cited me. I wrote that in 2019. I wanted to get a citation out there. So Central State has observed, this was from Dr. Hunt, our coordinator across the street. Anybody know Dr. Hunt yet? Have you met her? She is the head counselor right across the street. If you ever need counseling, just walk across the street. She's noticed 60% increase in the number of students seeking intervention for depression or anxiety. So what that looks like is, did you hear how many new freshmen there are this year? How many new freshmen do we have? Was it like 500 or 800 new freshmen? I know we have 1,700 students total. So let's say 100 going for anxiety and depression. Since coronavirus, now we have 160 going. So that's the 60% increase. And it's stressful time. So it's the economy, it's the coronavirus. We've all had deaths in the family. We've all had just challenging times, along with a war started just about a year and a half ago. We had interest rates increased, the cost of food increased. So lots of different, I see that more on the anxiety side, but sometimes when you're anxious for many days in a row, that can also lead to like a burnout into depression, where you're just like anxious, and then you're like, dude, it's stressful. I'm depressed. And so we're looking for different interventions like that Dr. Hunt can use. So we're aiming to train our social workers for the future. So some of this looks like we also want to educate the public, employers, school systems, government, health plans, and others about the stigma around behavioral health disorders that create barriers to workforce development. So getting more social workers out there. Relevant licensing boards, behavioral health organizations, state government agencies, and Ohio General Assembly in partnership with Racial Equity and Behavioral Health. We want to educate the systems that overlap with behavioral health, healthcare providers such as primary care and basic behavioral health and cultural competency trainings to build awareness how they can improve and bridge access to behavioral health services through Behavioral Health 101 or Mental Health First Aid, and then evaluate local and statewide behavioral health care for workforce, like getting more folks out there, getting more of you trained, getting you all. How many want to get a master's of social work? Is it like at least half of you? Then you can provide, you get double the pay. You don't need to get a master's. So if you get a bachelor's of social work, you still can get your license and work out there. So also arrange, finance, and formal mentorship programs that pair BIPOC professionals working in behavioral health with BIPOC students. Do you guys know what BIPOC stands for? Anybody? It was new for me. Do you know what it stands for? Can you say it loud? So
Black Indigenous people.
Okay. Yes, that is it. And it is a new term. Like, I feel like it's only come on the past 2-3 years, right? Or maybe it's just gotten big. Do you remember when you first heard it, or how did you first hear it? Okay. And so we want to have for our school training for mental health for BIPOC students. We also want you all trained as social workers to serve BIPOC individuals. And mandate cultural competency training for faculty, staff, and administrators. So that's me. You know, I grew up in Cincinnati. I grew up in Kennedy Heights, but having a way we can serve our students better with both the trauma-informed care training, maybe horticulture therapy. These are the last 3 here. So establish community and behavioral health partnerships to credential behavioral health professionals in a 2-year degree program. So that means also addiction studies is a 2-year. You can get your chemical dependency counselor assistantship with a 2-year. Trying to infuse horticulture therapy because we do have an agriculture program. So we want to develop curriculum to introduce behavioral health to younger students, provide trainings and certifications such as mental health first aid, and hold health career education programs like fairs, camps, etc. Also establish stackable certificates. So maybe you want to do addictions and horticulture therapy. So you can just start stacking them up. And when you go out to get your job, they're like, I do this and this. For early entry into the field, and then when developing career awareness messaging, reinforce that the values of behavioral health field is reputable and valuable health profession that serves people with mental health or substance use disorders. One other thing we do talk about in terms of mental health and why we want to have horticulture therapy, where you're also growing your own food for food security, is the food insecurity on campus. And food insecurity affects your mental health. So we started a food pantry that is in social work. Has any of you seen the food pantry yet? We're in the 311 Wesley Hall. You've seen it. You came up. Come up anytime, get food, snacks, real meals, healthy stuff, and unhealthy stuff. So we've got all of it. But we saw this and writing some of this grant, while CSU on-campus food pantry is managed through our social work program, we're going to try to establish internship and employment opportunity for majors from other areas. So maybe agriculture and folks to grow fresh vegetables. That's the only way to get like fresh stuff on campus. We have faculty on the proposal from social work, psychology, and exercise science. So we're all working together. We're going to add agriculture so students can do your internship. Food pantry will serve as a multidisciplinary opportunity, potentially benefit our 1890 land grant support from the USDA program on campus, and provide CSU grown produce to our students. So this is what we're looking for with a internship in horticulture therapy, to reduce the food desert aspects of the campus and to enhance our students' daily dietary consumption. So we are at like halfway through. I want to see if there's a timer on that. So here's the grant that we wanted to, we've submitted as of last month. So grants for implementing horticulture therapy at Central State University. And you guys will be the first to get a chance at this because you're the social work majors. It always combines social work and it also combines agriculture, horticulture, like the knowledge of growing food. Anybody here ever done a garden? Anybody have a garden at home? Anybody have family that does a garden? Who is it? Who's the ones that do it? Okay. Is it good? Is it big, or is it small and like just green beans, tomatoes, or cucumber? Herbs sometimes like basil. Okay. So we applied this grant at the National Institute of Food and Agriculture. So that's NIFA. We applied. It's actually a $500,000 grant because we wanted to be able to fund. A lot of it goes to materials, so like a greenhouse. That way we can grow food year round. Anybody ever been inside of a greenhouse before? We have one on campus. So we're trying to get another one. Then you could grow food year round. Like right now, my garden's starting to die off. And winter, you often take time off in the garden, but with the greenhouse, we could have the chance to grow year round. So growing food for the food pantry for folks that need it. So we threw some of the application pieces out. So they already have counselors over there. Dr. Sonia Hunt is the head of counseling. She has about 3. So we wanted to also get her 3 more part-time counselors. So that was $25,000 per year. That would be 20 hours a week. So for somebody who also may bring an expertise in horticulture therapy. So that's $25,000 per year for the counselors. That's $75,000 we wrote. The greenhouse is also a lot. That shows up later. We had also 5 third-party counselors trained in therapeutic horticulture practices that will oversee the application of techniques for Central State University students. So if you did your internship with Dr. Sonia Hunt, you all do it your senior year. You can do it with her, and if this grant is awarded in March, training in horticulture therapy. So training of Central State University staff and assist in data collection. A lot of times when you get a grant, they want you to throw back the numbers. Like, what did you do with this? How did you guys push out um, the different grants? So, no, go ahead. Go ahead.
Internships in that senior side.
There could be, yes. In social work, there's a mandated internship. So that's what this is referring to. When you graduate, there's a 400-hour internship you do, which is cool. Is if you did it at Child and Family Services, you get a job when you graduate at Child and Family Services. So that's senior year usually. Some people may do it fall or spring. I often recommend folks, like if you have a specialized area that you want to do it in, like child and family or horticulture therapy or aromatherapy, like do you go home for summer? I often say start looking now and like communicating with agencies, like look up different agencies that offer what you are looking at specifically. There are some on campus, but again, because we're in the middle of nowhere, it's like a rural campus, our only counseling agency is Dr. Sonia Hunt. You know, there might be some more 3 miles away in Xenia, but that's a very small town. So if you did want to do it during the school year, I would say start searching Xenia. Like if you wanted to do it at the courts or if you wanted to do it at juvenile facility, we do have interns there. It's just there would be the one that counts for your social work education, and there would be one you just like would put on your resume. Or have you ever led a summer camp? So sometimes that stuff, sometimes people infuse their thoughts about horticulture therapy into summer camp too. So I don't know if that answers your question or not. Okay. We also have 12,500 for the 3 case managers, and they would be more for 15 hours a week. So this would create a space where you could do like an internship and be a case manager. So a case manager will be contracted by the project to help students understand their options concerning the specific situation which they're dealing, act as liaisons between patients and counselors, and track therapy progress and individual cases. So a lot of times a case manager does help with basic needs first. So like food, water, shelter, housing. So maybe if there is a bad housing situation or food insecurity, things of that nature, that's what they would look for. We also requested for greenhouses. So at least one. So the equipment is $25,000. So funds are requested to purchase a prefabricated greenhouse kit. So in the grant, that was part of the thing that we could not write as a permanent greenhouse in, which is probably $100,000. But they sometimes have in grants where they ask you not to buy building specific items, like a permanent building, which is very expensive. So this one said, if you get this grant, you can't have any permanent. So we decided to buy a not permanent greenhouse. That way we could move it around. Like if they wanted to go down the street, they could pack it up and move it down the street, or it goes in the field over here. So it's a polycarbonate panels with cold steel frame, but it still has fans, a heating system, because that's the key. You can't go below freezing and grow tomatoes. I don't think tomatoes actually flower when the nights get below 47 degrees. So like last night, it was 50 some, but 2 nights ago it was 47. So that means like if a tomato, you always see how they get yellow flowers and then grow a tomato. If you've seen tomatoes grow, always flowers first, then a tomato. At 47, it would abort those flowers because it's like starting to, finish the fruit that's growing, make sure that the seeds are fully developed for next year. So it puts it into the fruit that's on there and then ripens. And, it's kind of like the cycle of life. So the way that we try to have kids and pass on our genetics and whatnot, the flower does the same thing. So proposed to provide a temporary space for horticultural activities associated with the project. The package will include outfitting such as grow tables, benches, and carts, and that's $25,000. The research aspect in our project, and this is something as students you guys could help with, it compares the pre and post mental health of students who participate in therapeutic horticulture. And so specific plant characteristics, which may be more therapeutic, and any differences in individual versus group intervention. So Dr. Hunt already tried to do like a pilot study where they grow a mother-in-law's tongue. I don't know if you guys have ever heard of a plant called mother-in-law's tongue. So it looks like a snake's tongue. It's like that plant that's like this thin and it's like pointy at the top. So I think that's why they call it mother-in-law's tongue, is your mother-in-law is always like a snake. Like she'll say nasty things about you to your spouse or whatever, or, you know. So that's what they're growing, is it's easy to grow. I guess that's what I'm trying to get at. But that was with agriculture. So he had the plants. With this funding, we could expand and have more edible plants, perennials, fruit trees, even berry bushes, things of that nature to effectively reach the largest audience. The teaching aspect will be development of a therapeutic horticulture certificate program. So this is in conjunction with social work. I want to try to have social work if you want to do therapeutic horticulture with children and families, or with addiction recovery, or with prison population, wherever you'd like to do it. We want to encourage that. So it will provide CSU students with a unique certificate program to draw in students and provide current students with additional credentials upon your graduation. So you could be a BSW and an LSW, that's Bachelor's Social Worker and a Licensed Social Worker, and a registered horticulture therapist, which is kind of cool. That's what we're aiming for. And to offer this to our students through Dr. Hunt. Then the Central State University Extension Office will be involved in promoting therapeutic horticulture to the community and teaching this technique to disadvantaged groups and individuals. So a lot of times we offer summer courses. We do hire, actually now I'm totally remembering, we do hire students for that. And that is in the summer, and you do live on the dorms, and you kind of run the summer camps here. And I remember that. It's almost like Upward Bound. So I don't know if Upward Bound comes to our campus. Upward Bound programs is usually, again, like introducing kids that want to go to college but might not have totally the means to, or they're first generation college students. So like my wife, their parents are like, oh, you don't need to go to college, just go get a job, like don't waste your money. But we try to introduce them to college and see the different things they could do, like horticulture therapy, and they do get paid. So I'm remembering this now, as we had 2 students this summer. They did stay on campus, they do give you housing, and they do pay you. I don't know how to find where to apply for that. That way you could apply at home and here and see which one is more competitive pay. Like, are we already? Oh, look at that. Uh-oh, we're getting there. So a few final statistics to throw out here. The Association of Black Social Workers, white test takers pass at 83%, whereas black test takers only passed at 45%. So we're trying to infuse more training for the test, on the licensure test, to match that 83%. And that's all throughout state of Ohio, national stats and everything, because ASWB is national. Also, 12% of Ohioans identify as Black alone, and only 4% as Hispanic alone. And there's only 4% of all Ohio psychologists, this will make sense of a stat to you, are Black. So there's a disparity there. We want to have more licensed professionals. Hispanic psychologists constitute 2%. So instead of 12%, there's 2% for Hispanic psychologists. Oh, I'm sorry. So it's still half, and then here at 4%, it's like a third or a quarter. The vast majority of pharmacists in Ohio are white, just 3% of pharmacists are Black, and a half a percentage are Hispanic. So in many professions, educational requirements increase. Black professionals are increasingly underrepresented as compared to white counterparts. So we wanted to up those numbers. We want to have more people graduate here go take the test, go serve the community, and be able to serve folks in the community, because our um, research is showing that if you are being seen by somebody who has a similar experience to you, you're more likely to go see them. Would you guys say that's true, or that's kind of what the research is showing? So that is kind of the grant that we are adding in, um, trying to make available at Central State University, um, to also have horticulture therapy at Central State University. So let me see here. Any questions about that? Do you guys have any questions about work being done? So when Dr. Hunt did do that pilot study, we did write up some of it to publish last year to see, like doing horticulture therapy on campus here. So one of them was it's important to use sensory-based approaches, and you can do that in and with horticulture therapy. You could grow mint and lavender and different, like actually getting out and doing, digging in the dirt and digging in the soil is important. And then at Central, working with the trauma-informed care model. So one final thing was Central State University Counseling Services has a NAMI chapter on campus, so National Association for Mental Illness. It's student run, and members are advocates. They're trained in suicide prevention, trauma-informed care, and mental health first aid. And that's another thing that Dr. Hunt has done. And with the horticulture therapy, we wanted to have more stuff that we could offer for folks that were being served and affected by, just trauma in general, just pandemic trauma overall. So I will end with questions. So any questions on that, how you cite your stuff? So here's another way for your next paper, how you cite. Tell them to come to class. Say, come on into class.
He's at school right now.
What school is he at?
He goes to school in Columbus.
Oh, okay. I think you guys are allowed to take some remote from Columbus if you wanted to. This is the last thing I needed. This will be fun. Do you think all of my references will fit in this tiny little page? That's going to be janky. Yeah. I should probably cut half on the other side, but let's see what it looks like when you play it. This will be fun. Bigger font needed. Doesn't look good, does it? That's the hardest part, though, is when you write your papers in APA style and just having that proper formatting towards the end. Do you guys have any questions for your next paper? Let me look for you. It's inside of D2L. We probably did. I think it was due next week, and then we just kicked the can down the road for another week to do it. Okay, that sounds right. Maybe it was October 5th. Let me look it up for you. But again, it's International Federation of Social Workers, and then National Association of Social Workers. See what they do, populations they serve, and then, oh, is this it? No, that's a different class. You guys are 1100, right? So go into assignments, the only 3 things that I use in class, because I'm not certified to teach online still. Online classes are crazy. Anybody like online classes better? I don't either.
All my work is online, so like if I stop showing up to class, like I do, besides one class, I can probably do every single, like, school work online. So it's like
Right.
basically doing online school.
It's usually more work when it's an only online class.
Yeah.
Because you got to read it and teach it to yourself and learn it yourself and do all the PowerPoints yourself. There's nobody teaching it to you. Sometimes they do and read over the PowerPoints, but a lot of times they don't, right?
I don't know, because my brother does online. He goes to local force, but he's at home in Michigan. And I guess he likes it enough because he has to work.
Okay.
But I think they have like a class meeting or something.
Okay.
So it's not just like it's like Zoom almost, like
Right.
what we do in high school.
Oh, right.
So
Okay.
I don't know what we do here, but that's what they do for my brother.
Right. Let's see here. Looks like it is October 5th. Ah, there you go. So we did push it back to October 5th.
Yeah.
What's that?
Yeah.
Oh, anybody have an extra pen? I don't. Everything's gone so electronic and digital. There is one other horticulture therapy we did. There was addiction recovery and horticulture therapy. Ah, so you guys have Dubois and Miley. Do you all get access to the book still? Is it something that they give to you?
What was the question?
Do you get access to the Intro to Social Work book? Like, is it digital or is it a hard copy of the book? Or both?
Probably the digital.
They're supposed to give you free access is the deal. Like you already paid for it in your tuition. And that's good if you do. If you don't, we'll work with it. We'll send you the different PowerPoints for each chapter. And then your next assignment, this is where we got to start pushing we're stacking assignments at this point, but by say like the 19th, we want to have, well, you guys can start presenting. What's that?
He's excited because he's asleep.
Right. Yeah. You know, it can get rough. You know that.
Your work is crazy.
Just life. I'm going to say the PowerPoint is due like the week following, mainly because, yeah, but you can present it anytime in October. So that's what I want to do. Like October, you can come in and present the way it's described in the syllabus, the thing that we talked about, going to eat at Frisch's or go over to Chick-fil-A at Cedarville. That's a very different college campus, very different. And just observe the differences being from, they had us do it at University of Kentucky in Lexington, because I was from a big city in Cincinnati, and just see how people are different and see if they treat you different and see if your expectations of how they would treat you would be different. Some people are like, everything was status quo and nothing was different. And some people found that it was, they were rude. And so just write how it happened, how it went down, and how, one thing our students found was there used to be this thing called like fire pizza. They had college day here in like Xenia or Dayton, and it was open to like Wright State University, University of Dayton students. I'm trying to name all the colleges around here. They did not list Central State University or Wilberforce. And a student like doing this project kind of actually called him out for it. And I think the community called him out for it and got that changed. Like, dude, we are one of the local colleges. Like, thanks for the recognition. So just examples of that. Some people went in, they're like, oh, these country bumpkins are going to be rude to me because I'm from a different city or whatever. And they were totally fine. So whatever your experience is, just write about it. And that's it. The way it's described in the syllabus. So we'll have that one. It will say due on the 10th. You can present as early as when the next one's due, like the 5th or the 7th, but just to get you guys thinking of the PowerPoint presentation in the syllabus. And that's all that I have for today. I know it's 10:21. Yeah, we'll get him to sign. I remember, so I fell asleep in my first class ever in the university, and I went to Xavier University, so it was a Jesuit priest who taught us. He was actually kind of a nice guy, and he threw chalk at me. It was back when they had chalkboard. He threw chalk at me. He was kind of like joking and being funny. He wasn't a jerk about it, but he's like, dude, here's some chalk. Here's a sign-in sheet for you. But it was just funny to have him do that. And it felt welcoming. I was a little annoyed at first, like, whoa, and he just threw chalk at me. So see you all, gosh, in another week.